𝗱𝗵𝗹𝗆 here. Today I just want to talk about something that I run across a lot in my practice, my specialty facial therapist practice up here in Seattle with patients. Especially initially, there is a lot to work on that is that should be part of your daily routine in your facial rehab program at home. There's so many different areas to address in order to feel like the whole face relaxes enough to allow more movement and feel more relaxed overall and feel better, because that helps decrease the pain. The problem that a lot of people run into is just being compliant and finding the time to work on their home program. And if you do not have a home program already, I would highly suggest that you get a consultation with a facial therapist, and only a facial therapist, not a regular physical therapist, as they are not necessarily trained and don't know how to do and what is appropriate to work on at any specific time and timeline of your facial therapy, facial palsy rehab. So, like I said, a lot of people are struggling with that, and my recommendation to increase compliance and make it a little less overwhelming to deal with every day is to sprinkle those exercises throughout the day. Find a specific habit, something that you do several times a day, and what I would do is every time you're doing this particular action. This will help just kind of build and do a little bit of everything, a little bit of all these exercises throughout the day without feeling overwhelmed and without feeling like, oh, it's the end of the day, I have to do my facial rehab, I have 20 minutes worth of stretching or massage, and later on neuromuscular rehab. But this is a bit much. The face gets tired extremely quickly. Even if you do more than, I would say, 3 massages, your face might be already feel like extremely tired. So I don't recommend doing your facial rehab that way. That way works well for if you're dealing with any other orthopedic musculoskeletal condition in your body, and you're having, if you've had physio before, physical therapy, and we're given a home program, that is fine to do a lot of these exercises all at once. But for the facial rehab, considering and especially with the weakness of the face initially at that time, I would just spread it out throughout the day. I think that is the best advice I can give you. This might help you be more compliant, because I know it's very difficult to be compliant every day for several months, sometimes for years, for some people that have to deal with this for a while. And I had a patient this week that was somewhat apologizing that he was only 90% compliant, and I was, it's pretty rare when you're a physical therapist. You see a lot of people being non-compliant with what you're showing them and teaching them and encouraging them to do in order to address their symptoms. And to be honest, 90%, I'm pretty happy with that. If he was doing his exercise 90% of the time, it's that he should, that's pretty good. So, and again, when you work with a therapist, you're not doing this for them, you're doing that for you. So that's also something I want you to remember. So anyway, I hope that's helpful. Just again, to summarize it, just sprinkle it out, spread it out throughout the day, here and there. Maybe when you're driving and you're at a red light, maybe when you're going to the bathroom, maybe every time you take a sip of water, do a stretch, that kind of stuff. So, all right, I will catch you later. Take care.